Hi, my name is Dr. Montse Torremorell and I'm a faculty member at the College of Veterinary Medicine at the University of Minnesota. In this following module, I will discuss the clinical presentation of PRRS and what we see in an outbreak. This is important in order to properly apply diagnostics during the different stages of PRRS infection. When PRRS infects a pig, it can do it through different routes, including the respiratory route, if infection happens through contact or inhalation of infectious virus, the intrauterine route, if the infection takes place with infected semen, and directly into the bloodstream if the virus is introduced via injection. PRRS virus replicates in macrophages and rapidly spreads to lymphoid organs, lungs, and less consistently to other tissues. PRRS is distributed systemically and can cause subclinical and clinical disease. The infection may resolve rapidly, but more frequently it results in a persistent infection where the virus can be found in tissues for prolonged periods of time and subsequently shed in oropharyngeal fluids, semen, blood, feces, and urine. The clinical episodes of PRRS are age and production stage dependent. Generally, clinical disease and consistent lesions correspond to the time and sites of highest viral titers in lung and lymph nodes. In pregnant sows, we see reproductive disease characterized by abortions, premature farrowings, stillbirths, and mummies. In stillbirths and congenitally infected live-born pigs, the viral antigen can be found in largest amounts in lymphoid organs. In neonatal pigs and weaned or growing pigs, we will see respiratory signs due to pneumonia associated with mortality. Boars may also be infected with PRRS, and the infection may result in fever and morphologic changes in the semen, although these changes may be seen in some boars but not all of them. In this slide, I want to show what happens in regards to viremia and the immune response after a negative pig has been inoculated with PRRS virus. In the graph at the top of the slide, we can see the results on viremia and the production of interferon gamma producing cells. We will focus on viremia here, and we can see that virus can be detected in the blood shortly after infection, and that viremia increases rapidly, reaching peak in 7 to 14 days, and subsequently decreases. So when using virus isolation, viremia can be detected up to 28 or 35 days in a nursery age pig, or up to 48 days in congenitally infected pigs. Viremia can also be detected for shorter periods of time than that in adult animals. However, if PCR is used, viral RNA can be detected in the bloodstream longer, and there are reports that it can be detected for over 250 days. We also have to take in consideration that there might be differences between pigs within a group in the way how viremia or any immune response is presented. In this slide, I want to show the variability observed with the level of viremia in a group of experimentally infected pigs. We see that for the most part, viremia follows the same pattern across pigs. However, for example, if we focus on day 28, we see pigs that they were virus negative, and then we see pigs that still had a very high level of viremia. Understanding the variation that there might be within a group of pigs is important to properly apply and interpret diagnosis. In summary, this is what we want to remember about viremia. It starts shortly after infection. In 12 to 24 hours post-inoculation, we may already find the virus in the blood. It peaks between 7 to 14 or even 21 days after infection. At that time is when we will find the highest load of virus in the blood. It may last in a nursery age peak up to 28 to 35 days post-infection if we look for the virus using virus isolation. Detection in the blood, however, it may be longer than that, and it's been described to be over 200 or 250 days if we use PCR. The detection of viremia may be slightly longer in congenitally infected pigs. So in pigs that went through an infection in utero in the phase of an acute outbreak, we may find those pigs to be viremic for 48 days so slightly longer than pigs that would be infected after birth. In adult animals, viremia might be shorter than compared to younger animals, and in pigs with immunity, the duration and magnitude of viremia may also be affected. And as I said, generally speaking, it will be lower and less predictable among individuals. I do want to emphasize that even in a group of pigs where the pigs have a similar age and similar immune status, we will see variation in the pigs in the response in regards to the load and the duration of viremia. Now I want to focus on the graph in the lower part of the slide. Here we can see the antibody response against PRRS in a negative pigs. The line at the top measures antibodies against the nucleoprotein, which is produced in large quantities. Antibodies can be detected between 7 to 12 days post-infection and reach their peak by 21-28 days post-infection. These may remain high for a prolonged period of time, as indicated on the slide, and that's what one of the advantages of an ELISA or the detection of antibodies is that we may see whether an animal was exposed for a much longer period of time if we compare to a PCR. Neutralizing antibodies peak at a later time, here about 42 days. However, measuring neutralizing antibodies is not done on a regular basis or on a routine basis for diagnostic purposes, and it's more used for research purposes. Now, if we go back and talk about clinical disease, one of the things we will see in the phase of an acute outbreak, we will find that mostly everybody becomes affected in one way or another. Some animals may show signs of fever, even anorexia, and some others may not. But we may see a large number of animals that stop eating and they have a temperature. In the case of a chronic disease, in particular, we don't see very clear reproductive signs, or at least they tend to be much more sporadic. They tend to be insidious, and for the most part, we will see respiratory signs. In the case of a clinical outbreak, on the reproductive clinical signs, what we will see is an increase in late-term abortions. We will also see an increase in the number of large mummies, increase in stillbirths, increase in the percentage of premature farrowings around 110 days, if not slightly earlier. And as a result, we will see an increase in pre-weaning mortality and an increase in the number of weak-born piglets. And we will see an increase on pre-weaning mortality associated with pigs having respiratory signs or signs of thumping. There might be a delay on the estrus or an increase in the percentage of irregular estrus cycles. This slide summarizes the clinical presentation in a sow herd when we use production parameters to evaluate the impact and the time when PRRS infection took place. The data presented here corresponds to a single farm that went through the clinical episode, and it followed whole herd exposure protocols, which is illustrated with the time 0. The vertical line corresponds to the time when the PRRS infection was detected using diagnostics, and then time 0 is when the herd was exposed to whole herd inoculation. What we see here, first of all, is in dark blue, it's a drop in the farrowing rate, which is illustrated with the dark blue and then corresponds to the data on the left axis. We see a drop in the farrowing rate. What we see also is an increase in pre-weaning mortality, which is illustrated with the light gray and also corresponds to the values to the left-hand side. Interestingly enough, we see a significant impact or a significant increase on the abortion and the abortion rate, and it corresponds to the color dark gray and to the data on the right-hand side. Interestingly as well, we don't see a change in the total number of born piglets, which is illustrated in brown, but we do see a drop in the number of born alive, which in here is illustrated with the color light yellow. So there is an increase in the number of born dead or a decrease in the number of the born alive. The data that summarizes the whole thing in one way is the number of pigs weaned per sow, and here it's illustrated in color in color mustard, and the data corresponds to the number seen in the right hand side axis, and we see a significant drop on the number of pigs weaned per sow. These pictures illustrate what we will see in the phase of an abortion, or in this case is premature farrowings. Piglets in the same litter might be a few piglets born alive but be very weak and not looking very good, and then we may have some mummies, large size mummies, and a number of piglets that may just be stillbirths. That's a common finding of the different stages of the status of the animals in the same litter that it's affected with PRRS. In the nursery or prior to wean, we may see piglets that again infected with PRRS. They will look sick. This is a condition we tend to see this mostly when the infection happens in utero or shortly after birth. Piglets will tend to pile together, have fever, be cold. Many may have diarrhea. So often we'll see an increase on diarrheas during the phase of an outbreak. So in the case of a respiratory clinical disease associated to PRRS virus, what we may see is an increase in coughing due to interstitial pneumonia, and also we may see an increase in secondary infections due to other bacteria or viruses such as Haemophilus parasuis, Streptococcus suis, or influenza or other pathogens. It's important to recognize that the respiratory signs or this cough might not be specific, so other diseases may cause similar clinical signs. So in this case, it will be very important that the diagnostics have the support of laboratory submissions. So in summary, the clinical outcome may change based on the age of the animals, and in generally speaking, the younger the animal, the more severe the clinical presentation will be, and the more virus and viral load and more severe lesions they will have. The stage of gestation or the production stage, it will also influence the clinical outcome. Pregnant sows, in particular the ones in the last third of gestation, they will be the most affected by the PRRS virus. The virulence of the strain will also influence the outcome of the infection. The presence of co-infections will also affect the overall economic impact of the disease. Pig genetics as well, there are differences in families, genetic families and genetic lines that will influence the outcome of the virus. Congenital infection, whether the infection happens in utero or whether the infection happens during the life post-birth of the animal. That will influence the susceptibility of the animals to PRRS virus and also to secondary infections. Whether there is prior infection or whether there was prior infection or whether there is existing immunity will also affect the outcome, and the vaccination status will also determine how severe the disease is presented. Thank you.